Thanks for your interest in healthgroupcoaching.com. I'm the founder, Dr. S. Rawat. And in this video, I'll be telling you my story, as well as the story of many of my clients who have successfully not just lost weight, but also in many cases completely reversed their metabolic conditions. So I'll tell you what my motivations are and what you can expect to achieve if you join with me on healthgroupcoaching.com. So behind me you can see beautiful North York. That's the Parkway Forest area on the intersection of Don Mills Road and Shepherd Avenue. That's where our clinic is located. And I conduct a group coaching program which is available both in person as well on Zoom video. The in-person sessions are available to any clients who have OHIP coverage. I use certain billing codes called out-of-basket codes, so your doctor's billing will not be affected as long as you don't see two doctors on the same day. While the virtual sessions are available for my own rostered clients as well as private clients. These are small group sessions. We cap each group to a maximum of 10 people. And so it's really engaging. Usually it'll be a 1-hour session once a week. I'll initially do a 20 to 30 minute presentation discussing a topic. If you go on my website, healthgroupcoaching.com, you'll see that I've written 70 blogs, published over 500 videos. And so I'll usually be going over a blog, and then we'll open the floor for roundtable discussion, which is usually the most fun part, where people learn from each other's experiences. People ask me questions, which I answer. Plus, people can simply be discussing their progress, how they've been doing, any kinds of problems they've been encountering in their journey for weight loss and reversal of metabolic disease. If you're interested in joining these sessions, then there is a OHIP client discovery form as well as a non-OHIP client discovery form on the website, healthgroupcoaching.com. First of all, who am I? I'm an Indian origin, England-trained, Canada-based family physician who additionally studied nutrition at Harvard and founded healthgroupcoaching.com, where I aim to help people lose weight and reverse metabolic diseases. These include fatty liver, prediabetes and diabetes, prehypertension and hypertension, obstructive sleep apnea, polycystic ovarian syndrome, etc. So why is it important to reverse metabolic diseases? Well, one good reason is that metabolic conditions account for the number one cause of early death and morbidity in adults. Once we get past the age of 50, and you could say between the age of 50 and 80, the two biggest dangers are the end results of metabolic disease, which include coronary artery disease, kidney failure, etc., and cancer. And so in addition to cancer screening, a healthy lifestyle, and medication, diet, exercise, weight control can play a major part in fact, not just reducing the incidence of cardiovascular disease, but also cancer. There are at least 10 cancers which are known to be directly associated with obesity. In fact, once we get past age 80 and we've dodged cancer and cardiovascular disease, the biggest danger then is neurological diseases, Alzheimer's, dementia, and the second most common cause of dementia after Alzheimer's is vascular dementia, again, which is majorly impacted by lifestyle, diet, etc., as well as timely use of medication to reduce risk factors like high sugar, high blood pressure, high cholesterol, etc. Now, there is an interesting story about how I got interested in this. For the longest period of time, because I passed out in 2007 from England as a family physician, I really wasn't that interested in this. I didn't have much training or knowledge in nutrition, and my immediate reaction to any medical issue, whether it was borderline high sugar, blood pressure, etc., would be to prescribe more medication. But there were two unique things which made me interested in this topic, which happened around the COVID-19 epidemic. Firstly, it was very clear that clients with obesity, hypertension, metabolic conditions were at much higher risk of dying of COVID-19 than other clients. And the pathophysiology of this intrigued me. Why was it that these clients were at higher risk? And that discovery led to the whole understanding of the pathophysiology of how weight gain causes inflammation and how that affects blood pressure, sugar, cholesterol, and increases risk overall. How those clients have a perpetual state of chronic inflammation. And it seemed that COVID-19 was just stirring things up to a higher level, which is why eventually the most effective treatments for COVID-19 turned out to be various types of anti-inflammatory agents. It just so happens during that time, because we were at home under lockdown, I myself gained weight, and my blood test also started showing some signs of the average sugar creeping up. And that concerned me, because my father was diagnosed with type 2 diabetes at around about my age right now. Despite being a marathon runner and really looking after his health, that's what he continues to be very healthy and still looks after his health, only taking 2 medications to control his diabetes even 30 years after the diagnosis. But the genetic factors, ancestral factors, the variability within ethnicities of metabolic disease, that intrigued me as well. Whether it was the thrifty genotype hypothesis postulated by James Neal or other kinds of hypotheses based upon subcutaneous versus visceral fat deposition, hyperplasia versus hypertrophy of fat cells, etc., I gained a huge interest in the pathophysiology of metabolic disease, which also led me to obtain a certification in nutrition from Harvard during that time. And it's after this that I founded healthgroupcoaching.com. The program's been running for several years now. Hundreds of clients have gone through the program already. And if you look at the testimonials, you'll see that there have been so many amazing cases of clients who did extremely well on the program. I particularly remember a young boy who had just gone into university who was diagnosed with poorly controlled type 2 diabetes. On the program, he lost 30 pounds in weight and was able to come off all his medication for diabetes. In fact, he's now got a normal sugar below 5.5 3-month average sugar with no medication at all. And it would be no exaggeration to say that several decades of healthy life have been added to this young man's life. And that is something that I'm really proud of, particularly really proud for that young man who was able to make all those changes, stick to the plan, and he continues to work hard even today. On the program, we follow science-based principles, and I would urge you to watch my other videos on YouTube and read my blogs to understand the concepts better. I don't promote dogmatic, extreme diet philosophies. You will find no keto, carnivore, paleo, or extreme fasting on the program. It is strictly science-based. We talk about how to achieve a nutrient-dense diet, which is not calorie-dense, a whole food diet, the diets which have got the best evidence for cardiovascular protection, including the Mediterranean-style diet and the DASH diet, and how these can then be modified to make them diets for a caloric deficit. We talk about how to implement restrictions on calorie intake, whether this is through change in diet, increasing exercise and activity, some degree of time restriction, particularly a certain format called ETRF of early time restricted feeding is what I recommend, as well as calorie tracking for those clients who are able to do that. We also discuss resistance training, the importance of building muscle, preserving bone mass for health. We also delve into more complex topics like gut microbiome, chronic systemic inflammation, and how to reverse insulin resistance. As I said before, all clients with OHIP would be eligible to attend my in-person sessions at the office. And so if you're interested, or if you'd like to refer any friends or family, then ask them to fill the OHIP client discovery form on my website. I also do virtual sessions, but those are limited to my own rostered clients and potentially to private clients as well. If you'd like to know more about my diet philosophy, then feel free to watch more of my videos, read my blogs on my website, healthgroupcoaching.com. Take care, stay healthy, and I'll see you at the next video.